So hello friends, welcome to my new video. So today I will be discussing on pediatric vision development and the vision chart used to assess the visual acuity in children. So as optometrists, it's important for us to understand how vision develop from birth through childhood because the visual system is not fully mature at birth. It gradually develop as the child grows, and at each age we use different types of chart and technique to evaluate their visual performance. So in this presentation, I will take you through the stages of vision development and explain which visual acuity tests are appropriate for each age group. Let's start. So here, uh, pediatric vision development start very rapidly from birth to adolescence. So early detection of any kind of visual anomaly is very important. And here, we, as an optometrist, our role is very crucial. So here, before going to the detailed discussion on this pediatric vision development, I would like to tell you three keyword or important term that we use generally, but we most of the time get confused in it. These are infant, what are infant, who are toddler, and who are school going. So infant means if the child age is about birth to 1 year, you will call it as infant. Toddler means 1 to 3 year, and school going are 5 year or above. They are school going children. Okay, so let's quickly go through how vision develop in children from birth to adolescence or adulthood. Okay, so first, birth to 1 month. So at birth, babies only have light perception. They can detect brightness but not focus well. So fixation is still very poor at this stage. Now let's go to the 2 to 3 month of age. So here, by around 2 to 3 months, babies start to do fixation and following object. So here you will notice them tracking a moving toy or a parent face. So that's when eye coordination start developing. Then in 4 to 6 months, so this is when the binocular vision development start. Both eyes start working together and babies start judging where things are in space, and their eye movement become more accurate here. Then 6 to 12 months, here depth perception form during this period. So now they can tell how far or near something is. That's why they start reaching for objects confidently. Then in 1 to 3 year, from 1 to 3 year, visual acuity improve rapidly, and meaning their eyesight start getting clearer and sharper. They can identify familiar faces, objects, or simple pictures also. And 3 to 5 years. So here during preschool years, accommodation and stereopsis refinement is actually going on, so they can focus at different distances and have better 3D vision. So their visual skill become quite coordinated. And after 6 years, finally, around 6 years or above, vision reaches an adult-like level, roughly equivalent to 6 by 6 or 20 by 20 visual acuity, and their visual system is now fully mature like an adult person. So overall, vision does not develop instantly at birth. It's a gradual process that continues throughout early childhood, and each stage prepares the child for the next level of vision function. So, here, factors which are affecting the normal vision development, like if the baby is born as premature, then the vision development will not be that much nice like a normal child or normal baby. Congenital cataracts, strabismus, or coloboma, congenital glaucoma, all these diseases actually hampering the eye normal development. Or refractive error, presence of high refractive errors in children can lead to deviation of eye to inward outwards like this manner. Alongside the neurological disorders can lead to very much severe kind of problems like CVI kind of conditions. So it actually affect the developmental stage of eye. Alongside it affect the baby's functional ability also. So this is why importance of vision assessment in children is very much here. Why it is important to detect the amblyopia. Assessing the ocular alignment and fixation is also very important. Alongside monitor the visual milestone process and support the education and development need of the child. If you do the proper assessment in every 6 months or every 3 months, then it will be easy for you to track the patient's vision development. Okay, so that is very much needed. So here, vision development and chart, which chart used here? So here at birth, babies mainly detect light and large movement, but their fixation is still very poor. So you will notice they don't reach really focus or on the faces, etc. Okay, so they just respond to light or motion around them. So at this stage, we usually observe fixation following behavior. So here, in this kind of stages of the child, we can do the fixing following, or OK and drum test can be used. So to check if their eyes respond to moving strips. So this help us understand if the visual pathway are functioning properly. Then in case of 2 to 3 months, here uh, babies start showing better control. They can now fix and follow objects both horizontally and vertically also. So here we use a Taylor equity card, which are preferential looking card. And the idea is simple. The baby will naturally look towards the side with strips or pattern if they can see it. So if it help us to estimate their visual acuity even without any kind of verbal responses from the child. And around 6 months here, binocular vision develop, meaning both eyes start working together. So this is also when the depth perception begin. So the babies start to judge how far an object is. So to assess this stage, we can again use Taylor equity card, Lear pedal, which both work on the principle of preferential looking. They help us understand how well the baby can differentiate contrast or spatial detail using eyes together. So, in the first 6 months of life, we mainly rely on observation based and preferential looking test because the child cannot communicate with you, but their visual behavior tell us a lot about how their vision development is going on. So here you see that this is the OK and drum test that we do in children of like birth to 3 months or back to 2 months, where the child is not able to communicate with you properly. Then optokinetic nystagmus test is quite very much effective in this kind of thing. Another like here, Taylor equity cards. These Taylor equity card and Lear pedal, these two are based on the preferential looking that we force the child to see to the grating area, because it is normally seen that if we project a grating side and a plane, then child prefer to look at the grating, not the plain one. So this is how the test is done. Now, another is like here, let we discuss about the OKN. So OKN, known as optokinetic nystagmus drum test. So this OKN can perform to infant or very young children when they cannot fixate or communicate well. So this OKN can be done in the year like age of the child, birth to 1 year. And the principle, it is based on basic eye movement called optokinetic nystagmus. So what is this optokinetic nystagmus? So optokinetic nystagmus is simply the eye's natural automatic reflex to follow a large moving pattern. Like if I give you the example, like strips on a train, and then quickly jump back. So we use this involuntary, like the eyes are looking at the strip, moving it, and when it goes, the eye again jump to the previous position and then again follow it. So this is known as optokinetic nystagmus. So we use this involuntary follow and flick movement to secretly check how well a baby can see without a verbal communication with the child. So how this test is going on, or how this test is performed. So here, optokinetic nystagmus is having a black and white strip on a white background. So here, the child sit comfortably in patient parent lap, and examiner distance from the child is about 40 to 50 centimeter from the child. So here, the examiner will show the drum slowly and rotating, usually about 30 rotation per minute, and the strip move horizontally in front of the child vision or eyes. Watch the child eye movement carefully. If the child can see the strip, the eyes will show slow movement following the strip, and then quickly or quick jerk movement back. Again, here you can see that one. So this is the optokinetic nystagmus, when the eye is slowly following the strip and then quick jerk movement you will see. So the nystagmus should reverse as well. So repeat the test with different strip width. So like wider strips. First you will start with wider strips. So wider strips like this manner, where the child can easily detect it, and then slowly go to the narrower strip like this or this one. Okay, so if no eye movement is seen, it might indicate that very poor vision or lack of attention to the child. So the test is then repeated later. So here how this test is recorded. So if you see the presence of optokinetic nystagmus or fixing, and then again coming back to the previous position and then again following the strip. So you will write okay and present, or okay and absent if there is no eye movement is there. So if present means the child visual pathway up to the brainstem is intact. You can also estimate the visual acuity by noting the narrowest strip width that still produce the nystagmus. Border strip, lower visual acuity, and the narrower strip indicate better visual acuity. So OKN is actually four types of OKN are there. Vertical strip to see the vertical nystagmus, horizontal strip to see the horizontal nystagmus. No, in case of vertical, the it is used to see the horizontal nystagmus. In case of horizontal, it is used to see the vertical nystagmus. Color strip for color deficiency children's, and geometrical to make it more interesting. Now let's go to the Taylor equity card. So Taylor equity is the test is work on the preferential looking principle. Infants naturally tend to look towards a pattern area like strips rather than a black gray area. So when shown two sides, one with black and white strip and other plain gray, the direction in which the baby look tell us whether they can see the pattern or not. So here, if I tell you about the procedure, the Taylor equity card is used to assess the vision in infant or non-verbal children. The child sit in the parent's lap in a quite well-lit room facing the examiner in a fixed distance. So the distance here is about 38, 55, and 84 centimeter. Okay. So here, the Taylor equity card you can see here is having strips in one side and gray area in another side. There is a small peephole in this Taylor equity card through which the examiner will see the child eye. Now, examiner will hold the card in such a way that the examiner face is hidden behind this card, so that the child is only seeing the strips, not to the examiner. Okay. So here, the examiner will first start with what to say the more border strips, so that the child get the attention there and see the strips. If the examiner notice that the strips child is seeing that one, so then the examiner slowly reduce the width of the strips to see finer visual acuity. Okay. And when the child stop responding, the last card that attached their gaze indicate their visual threshold. So this special frequency is then converted into Snellen equivalent or visual acuity. So here recording of it, like here 0, here you will see test distance from the child or infant, the 38 centimeter infant under 1 year. 55 centimeter, you will be in 55 centimeter from the child if the child age is 1 to 3 years. 84 centimeter for older children. So recording will be like 0 to 1 month child, and you did the preferential looking to them, and the child is looking at the strips. Then at 38 centimeter, you will write 6 by 180 or 6 by 120. That is in the normal range. But if the child age is 1 to 2 year, I'm showing you only some of the examples how to document it properly. So 1 to 2 year and 55 centimeter, you will use this one. And then if the child is able to recognize all the card, then you will write 6 by 24 or 6 by 12. And here 3 to 5 years, then the distance will be 84. And if child able to recognize it, you will write it 6'9" or 6'6", something like that. So at about 6 year, child actually got the visual acuity similar to an adult level. It is 6 by 6 visual acuity. So here now let me go to the higher level. Here at 1 year, here you see at 1 year of age, babies start fixating and following object quite well. And you will also notice that their eye hand coordination is improving. So they try to grab toys and follow a moving light. For testing, we usually use here Cardiff Equity card because the baby doesn't need to speak. We just observe which side they look in it, and it's great test for infants also. Now, between 1 to 2 years, by this age, the child can recognize small pictures and shape. So apart from Cardiff, we can start using Leah symbol chart also. So this chart have clear, simple shape like a house, apple or circle that I will show in the later slides. From 2 to 3 years now, the child become more responsive and start identifying specific shape with better coordination. So we use chart like Leah symbol or keys picture test where they either name the picture or match them on a card. So it become more interactive and fun for them. Now, from 4 to 5 years, at this stage, their vision is getting close to an adult level, as I told you earlier also. So they can easily recognize or match letter and symbols there. So here we generally use like Leah symbol or HOTV chart, and these are easy for preschool children who might not know the full alphabet yet. And 6 years and above, by 6 years, their accommodation, convergence, and binocular vision are fully developed now. Basically, the visual system function like that of an adult. So we can now test with crowded Logmer, Leah symbol, Snellen chart, or HOTV chart like that manner. So as the child grows, their vision and understanding improve, and accordingly, we shift from a simple picture-based chart to a letter-based chart. So the key is to choose the right test for the child developmental level. Okay. So here you see this is the Cardiff Equity card is having blue and black line letter on a gray background. So here the test is done. I will tell about the Cardiff Equity card later in the next slide. This is the Leah symbol chart. Here the chart distance from the child will be at 4 meter, and you will give this card to the child and tell that if you are showing this circle to the child, ask the child to match this picture to this card handed to the child. Now child will match it with a pointed picture. So this is how you will record the patient visual acuity. So if the child is now 3 to 4 years something, then you can use HOTV kind of chart also. And more than 5 or 6 years, Snellen chart can be used and the child can easily tell you. This is the keys picture test. This is Leah symbol. So what is the main difference between them? So Leah symbol and keys picture test chart are both used to test visual acuity in pre-school children. So they use different sets that is very much easily recognizable by the children. So in Leah symbol, you will get 4 pictures: circle, square, house, and apple. Whereas keys picture, here you will get 6 thing like house, star, apple, shoe, and duck. So this is the keys picture. The difference is only the picture, the amount of picture available there. Now let's go to the Cardiff Equity. This is done to 1 to 3 years. So Cardiff Equity test is mainly used to check the vision in young children, and the age this is the 1 to 3 years of age. In non-verbal kids, so who can't even identify the letters properly or shape yet. So it's a very simple or clever test. So it works on the idea of preferential looking. Here you see the apple, sock, or this fish. Okay, so if a child can see a picture, they will naturally look towards it without needing to say anything. The test card have pictures like fish, house, apple, or sock, but these pictures are made with white and black line on a gray background. When the lines get very fine, the picture actually blend into the background and sort of vanishes. So this is why this test is also called as vanishing optotype. So if the child is able to recognize the small line images also, that means the visual acuity of the child is quite good. So Here, start the test with a large grating or large line kind of object, uh, and then present the card in front of the child, either upside down or upright, left, right position. Observe the child eye movement. If the child looks towards the picture, that means they can see it. If the child not look at the card or picture, that means they cannot see it. Simple. So gradually move to smaller target and continue until the child fail to identify the target. So at 1 meter distance, if the last correctly identified card correspond to the 6 by 18, and note that the visual acuity 6 by 18 is 1 meter. So normally, if I tell about the normal age range of this Cardiff acuity, like 1 year, you can write it like 6 by 60, 2 years it is 636, and 3 years it is 618. So this is how you need to do the Cardiff acuity card test. And this is actually very much beneficial for the age range of 1 to 3 years. Thank you so much. And if you have any question, you can ask me or in the comment section. I will definitely give you the answer of it. Thank you.